Today, I want to tell you the inspirational story of SB, whose story was shared in Biopsychology by Stephen Barnes and John Pinnell. I chose this case study because it provides an excellent explanation of bipolar disorder with elements of self-advocacy, as well as the way one patient can experience changing diagnoses. Throughout this case study, I learned about the different symptoms and types of bipolar disorder and the options available to manage symptoms. SB was a sophomore in college when he began to experience symptoms of depression as well as some delusions. Because he had witnessed relatives struggle with similar symptoms, SB decided it was time to see a psychiatrist. Some of the symptoms of depression SB was experiencing included sleeping too much, having trouble concentrating on his schoolwork, suicidal ideation, and frequent thoughts of death and dying. He also experienced some delusions, such as believing he was stupid despite continuously achieving high grades in school, believing no one liked him, and feeling persecuted by instructors and peers. When SB's psychiatrist offered to prescribe some medications to help manage his symptoms, he declined. He had seen relatives experience side effects that made him uneasy about any type of drug treatment. Instead, he decided to try psychotherapy. He found it helpful to talk through his problems, but ultimately saw very little overall improvement. Despite his symptoms, SB was able to successfully complete his bachelor's degree and move on to a master's program. Once he started graduate school, SB found that the severity of his symptoms increased to the point that it became difficult for him to function. He experienced severe memory and attention impairments, which affected even his ability to read. His delusions and suicidal ideations increased. Eventually, his psychiatrist admitted him to the hospital. While in the hospital, SB's symptoms were treated with antidepressants and antipsychotics. His doctor suggested that he take some time off from school, which he agreed to. He returned to school after a few months, but continued to experience severe symptoms and difficulty functioning. Despite continuing to struggle with depression and other symptoms, SB was able to complete his master's program and move on to a PhD program. After he began working toward his PhD, his mood suddenly improved significantly, and he began to experience symptoms of hypomania. In addition to his extremely elevated mood, SB found that he was able to be highly productive on less than 3 hours of sleep per night. He became highly sociable and charismatic, and people started to enjoy being around him. SB realized that he was able to read much more quickly and understand difficult topics in school that he had previously struggled through. The combination of symptoms SB was now experiencing met the criteria for a bipolar disorder type 2 diagnosis. The Cleveland Clinic compares symptoms of type 1 and type 2 bipolar disorders. The basic differences are that depression is longer lasting in bipolar type 2. Bipolar 1 includes episodes of mania, but type 2 includes only hypomania. And bipolar type 1 is more likely to interfere with daily functioning. Unfortunately, SB's symptoms got much worse. He filled his home with books and read and wrote constantly. He developed theories that he thought to be brilliant and believed that his intelligence and abilities were uniquely superior. His sleep decreased even more, and he sometimes went for days without sleep. He spoke so quickly that he was often asked to slow down. In addition to the symptoms of mania, SB's depression returned. He began to feel alone and rejected. He started experiencing constant suicidal ideation, and he continued to go with little to no sleep. He also frequently forgot to eat. After a phone call where he explained his theory in detail, SB's psychiatrist asked for a meeting. After speaking with him in more detail, the doctor realized SB was in a mixed state, in which symptoms of mania and depression are experienced together. The psychiatrist admitted SB to a psychiatric facility for 6 weeks with a new diagnosis of bipolar disorder type 1. During his time in the psychiatric facility, SB began to advocate for himself. After sleeping constantly due to the benzodiazepines that he had been prescribed, the resident psychiatrist prescribed mood stabilizers. After seeing the effects that the drug had on other patients and the doctor's lack of understanding about the drug, he became uncomfortable with having to take this medication long term. SB decided to take control of his life and utilize the hospital's library to learn about his disorder and different treatment options. SB's discomfort with the doctor's lack of knowledge about the medication that he was prescribing is a common ethical problem related to biopsychology and begs the question, should doctors prescribe medication without thoroughly studying and understanding the way the medication works and all possible side effects? During his studies, he found that the effectiveness of the mood stabilizers the doctor had prescribed had recently been disproven. Research found it to be no more effective than a placebo. Meanwhile, a new drug was giving doctors and patients more hope. It had already undergone clinical trials and was found to be more effective in managing bipolar symptoms and also had fewer side effects than the older medication. SB took his findings to the doctor, who agreed to try out the new drug. He found a new drug that had passed through clinical trials, was more effective than the older drug, and had fewer side effects. The end of this case study revealed that SB was actually Stephen Barnes, one of the authors of Biopsychology, in which his story was detailed. Barnes has had long-term success with the medication he discovered while in the psychiatric facility, as well as some other medications that help manage his symptoms. He reports that he feels stable and has fewer and less severe symptoms. Barnes's story is a testament to the positive role that self-advocacy can play in optimizing one's mental and physical health.